It's an honor to be here with all of you today and to share my personal and my clinical experience. This picture right here is a photo that I took of the Columbia River Gorge. On the left is Washington and on the right is Oregon. And it just looks like you're going on a journey. I like that. So all the photos in the presentation were taken by me except for two, and I bet you'll be able to tell which two they are. So as I was looking for free pics, I just realized that, I would rather just use mostly my own and keep it real. So here's me keeping it real. I love using laughter as medicine, and I hope this silly photo of me makes you chuckle or at least smile. I chose this photo because I'm out on a bicycle ride here. And riding my bike is one of my biggest pleasures in life, and I have a real soul connection with it. And my journey with fibro actually started 14 years ago with a knee injury while I was riding my bike. And it took me 10 years before I was able to get back on. And so it's a dream come true to be out on riding my bike and making silly faces. So that's why I'm here, is to share my ever-evolving best approach to treatment. And because I want you to be able to get back on your metaphorical bicycle. So a little bit about naturopathic medicine. It's challenging to describe the nuance of naturopathic medicine and how it relates to other modalities and treatment approaches. And I didn't want to take up too much time with the presentation with this, so I'm just going to talk about the education and licensure and what that looks like. So here's the education piece. So a bachelor's degree is required. Which that's required, and also the basic science prerequisites. So that's all required before you enter the 4-year school for naturopathic medicine. For example, my bachelor's was in psychology, and specifically behavioral psychology, and that comes in really handy because behavior change is a huge part of treating fibro, as many of you probably know. And then, so at naturopathic medical school, the biomedical sciences are taught, just the same as they are at conventional medical schools, but also a holistic approach is emphasized. So we get a lot of additional training in lifestyle counseling, nutrition, botanical medicine, physical medicine, and you can think like chiropractic type adjustments. We call it something else, but it's very similar. You're doing the similar thing. And we also learn bodywork modalities for physical medicine and minor surgery. We can also think like dermatologist type procedures, like removing a mole or stitching up a cut, or I think the most intense thing we do is like remove lipomas. But you'll find that not every naturopathic doctor maintains all of these modalities after they graduate. For example, I don't perform minor surgery or physical medicine. I need the physical medicine myself. As we all do. Licensure. So real quick, a little blurb. Naturopathic medicine in its current iteration has been practiced for about 150 years, though the roots stem from a lot of traditional medicine practices that are thousands of years old. So it's really a combination of the old and the new. And naturopathic doctors are currently licensed in 23 states, Washington, D.C., and a couple of the territories, Puerto Rico and the Virgin Islands, and then most of Canada. There's some area on the east part of Canada that we're not. In 80 countries throughout the world, naturopathic medicine is also practiced. So I will do my best to explain practically what licensure looks like, but it can be difficult to wrap your mind around. But licensure equals regulation. So what we can and can't do, which is called the scope of practice, educational requirements, continuing education requirements, basically all the things that you need to maintain a license and practice medicine in that state. And so it varies by state. So here in Washington and Oregon, the area that I'm in, we have some of the broadest scope of practice in the country, actually. So we can be primary care doctors, imagine all the things primary care doctors can do. And we do hold some positions in hospitals, though it's not so common. But let's say like I went back to the state where I was born and raised, which is Texas, where there's no licensure or no regulation currently. I would have to practice as something more like a life coach. I could still use diet, supplements, herbs, lifestyle changes, but I couldn't, prescribe pharmaceuticals or order labs or refer people to other physicians. So the NDs that practice in unlicensed states usually maintain a license in another state, usually the state where they went to school. And it's just to demonstrate their credibility and their educational background. And so these are the two extremes, and then there's everything in between. So a naturopath could be in a state where they are able to maybe order some labs or prescribe a few drugs or something like that. But it can be any iteration in between those. So before I get into talking about treatment, I'd like to touch on a few things about the psychology surrounding fibro. Which you could also argue is part of treatment. So, who's ever heard this? Fibro is a wastebasket diagnosis. And this is, maybe this will be my famous quote someday, but I like to say to these folks, just because you throw something in the wastebasket doesn't mean it's trash. So why do people say this, the wastebasket diagnosis? They don't know how to treat it and presume no one does. That's a big one, especially in conventional medicine. This is my favorite. They have confused science as a religion, or maybe as a fairy, and say, I don't believe in fibromyalgia. And for those of you that might get this, so this is a great time to play dead and pretend like you're Tinkerbell in the movie Hook and make them clap to revive you. Just, to demonstrate how ridiculous it is. They think it worsens outcomes due to over-identification with an attachment to the diagnosis and that it doesn't get at the root cause. This is the complaint I hear from a lot of my colleagues. And then many practitioners, including conventional and alternative medicine practitioners, think it's problematic because all the investigation stops in conventional medicine when the diagnosis of fibro is given. And so other diagnoses are missed. They don't get the care they need because everything starts to be blamed on fibro, basically. And of course, this doesn't happen all the time, but it happens way more than it should. So a diagnosis can set you free, or it can become a prison. We often cycle through different stages of feeling freedom, feeling imprisoned, feeling empowered. Having different levels of identification with our diagnoses. And some of the cycles are long, especially the ones that don't feel good, and we can feel like we've been stuck in them forever. But as we go through these different stages, like it's very natural to go through different stages in relationship to your conditions and physical health. We need someone to talk to about it, even if it's a tree or a favorite animal. I think we overlook the power of that sometimes. But of course, please don't forget the obvious. Friends, family, healthcare practitioners, support groups, therapists. The more people you can bring on, usually the better. So besides me being a sweet tree hugger in this photo, I don't know if you noticed, but this old tree on the bottom has died and a new tree has grown right in the center, right on top. And it's sent all of its roots down around the tree into the ground. And I love this as a metaphor for us fibro folks. Even though we may not always feel like it, we are very, very resilient, adaptive, and responsive creatures. And we are social creatures, and we need connection to others and nature to thrive. So some helpful tips. Keep cultivating your inner compass. Find your truth. Find what is helpful for you to navigate your journey. And try to surround yourself with practitioners, or at least get one practitioner in your life that honors those things. I think that's really helpful, whether they know about fibro or not. And learn what part of you is talking. This is really helpful, because when you can distinguish between when maybe your innate wisdom is talking or it's your fear, it can really help you decide what you want to believe, what stories you want to believe that you're telling yourself or not. And because we get to choose what thoughts and feelings we believe. And the better you can distinguish them, the better your journey the easier your journey can be. And so, yeah, it's the awareness and consciousness about the process that matters most, not about getting it right or only feeling good emotions or things like that. So please try not to should all over yourself. I tell this to my patients all the time, because if should were snow, then we'd probably all look like this picture of my childhood home. In my experience, fibro folks are almost always driven people. In fact, I think this might be a contributing factor to why some of us develop it, that pushing drive all the time, right? And this is why the lazy stereotype is so devastating to those with fibro. Not only are there now limitations to how much they can push themselves, but they also have to deal with the perceptions of others and themselves about how much they can do. And try to accept that your journey is going to look different to someone else's journey, and that's okay. No one is wrong in their process. And it may be part of your process to not accept the last part of that statement, and that's okay too. And this picture is actually a little spiral, little journey that was taken in my old neighborhood, or that was made in my old neighborhood by some children, actually. That's why I love it. And the type A personalities right now are looking at this picture thinking, oh gosh, I hope that's not my journey, right? Us type A's, we want a straight path for me to be, and we want to know what it's going to look like along the way and how long that it's going to take, and when we're going to get there and where we're going. But yeah, it's a process, and it doesn't always look so straight, much to our dismay, the type A personalities. So my approach to treating fibro, look at this mess of yarn. Obviously not one of the pictures I took. This is what my brain feels like, really, when I'm in with a patient. Everything kind of like starts to look like jumbled threads. So I like to approach fibro as a hairball, really, which feels more accurate because it's a little more chaotic looking, right? But you can also think of it as a web if a hairball just grosses you out. It's much more eloquent. But the web is so pretty, and it's just, it's not so geometrically done when you're looking at it, right? So we are looking for different threads we can pull that are going to give us the biggest amount of traction for unraveling the hairball or the web for that person. A little side note here about root cause. So it's worth noting that causes are very difficult to identify, especially in complex chronic illness. I prefer to think about how superficial or how deep we're focusing and what is our goal. The term root cause gets thrown around a lot by people in the health field these days, and I'm glad we're all thinking at deeper levels, but because the cause is so difficult to identify, you often can't be sure if you've hit a root cause or not, even if you get some really great results sometimes, right? And there's also almost always a deeper level to look at. And so being so confident that you've identified the root cause of something, I think can be pretty limiting. And for example, there's a huge campaign, I always see it on Facebook, about dysbiosis, or the gut microbiome being disrupted, being the cause of fibro. But then we have to ask what caused the dysbiosis, right? And so there's always, anytime I ever see these big big statements, right, about how we've identified the cause of fibro, or we've identified the cure, or whatever. It's just good to know that whatever someone is touting that way, it's really, I think the best way to look at it is just a piece of the puzzle or a piece of the hairball. So you can have multiple conditions, yes. And some of them seem to be, there's overlap between some of them, so it can get really confusing. And, conventional medicine likes things neat. And so sometimes it's not always that neat, especially with complex chronic illness, right? And so I've seen people, even my colleagues, that want to put someone in one box or the other. But, I think that if they meet both diagnostic criteria, then they meet both diagnoses, especially unless there's some contradicting things. There's always exceptions to the rule that would make that not work. But a great example of this is chronic fatigue syndrome, or ME/CFS, and fibro. They look very similar in a lot of ways, but I definitely see folks all the time that fit one and don't fit the other. But I see lots of folks that fit both. And you really can be missing out on some really good approaches to treatment if you're only looking at someone through the lens of one of them when they meet the diagnosis of both. So that's my argument for people having both. You'll see other arguments. But yeah, people often come to me suspecting fibro, and within a few visits, I've diagnosed them with 3 or 4 other conditions. This is really common, actually, with hypermobility and POTS. I see that a lot go undiagnosed, at least in the people that I draw. So I tell them not to despair, because I think eventually we're going to get a better picture of the intersection of all these conditions, and I think we'll come up with more efficient ways to describe folks that have many different diagnoses, right? So what makes a thread? Let's unpack this. Unfortunately, it won't be as cute as my kitty in this picture. What makes a thread? So pretty much anything goes. Anything can be a thread. There's hundreds and thousands of things that can be threads for people, right? And probably more than that. So everything listed here are just examples, some examples that we can try to pull. But there are, so many more. So many of them are interrelated, and pinpointing the exact source can be extremely difficult. Back to the root cause business that we talked about, right? And for example, concomitant illnesses, concomitant means just an illness you have at the same time, right? Like you have an autoimmune disorder and fibro, right? So concomitant illnesses, it's really tricky sometimes to figure out if those are actually a root cause, right? If those are causing something to be going on. So hold all of these things loosely, right? Symptoms are a little more clear cut. They're just symptoms. But so some symptoms here that I've got listed: sleep disturbance, chronic pain, fatigue, brain fog, constipation, headaches. The first 4 here are actually what I consider to be the core symptoms of fibro. I think that just helps to make it a little more clear. But of course, everybody's fibro picture looks different. And depending on where someone is in their journey, they might not even have all 4 of these symptoms at once. And some folks will discount things, right? If their pain is such an ever-present, overwhelming thing in their life, they might say that they don't have fatigue. But they really do have fatigue, but it's just not as impactful to them as their pain. So things like that happen too. Some things we might consider root causes: hormone dysregulation, dysbiosis, mineral imbalance, trauma, stress, and a concomitant illness: autoimmune disorders, MCAS, POTS, migraines, IBS, etc. There's tons. Okay. And so how do we pull these threads? So it's a collaboration at least in my approach. I hope it's a collaboration for everyone. But it's a collaboration between me and the patient. It's a balance of like what threads are most disruptive for them and what threads I think are going to give us the most traction. And trying to strike a balance between these is how we navigate and focus and determine where we're focusing. So I use a combination of addressing causative factors and palliative factors. So addressing palliative care is addressing symptoms to improve comfort and well-being. So basically symptom management. So really important. Not to lose sight of the foundations of health. Sleep, gut health, food, water, movement, mental health, emotional health, etc. So what I try to do is I do a mixture of both. I dig deeper while also trying to keep these foundations in place because they can be moving targets. You can get sleep in a really good place, and then when you start treating something else like the gut maybe, and then sleep suddenly is disrupted again. But it's usually not a like start from scratch kind of thing. If you've already figured out some things that work for sleep, it's usually just a matter of tweaking those things. And this process is very different for each person. It involves a lot of trial and error. So what do I mean by this? Some of the things I ask myself, is this the right thread to pull? This is the right time to pull this thread? Or does like pulling this thread jam things up even more? Or does it do nothing at all when we pull this thread? And this happens all the time. I really think like, oh, this is going to be a good thread to pull, right? And then nothing happens. Even though we tried lots of different things to budget, but and then I get surprised sometimes by things that I didn't think were going to be so impactful. So just so different for everyone. And then some other questions. So can we find a treatment to pull this thread, or do we actually have to work on causative factors? I've spent a lot of time trying to put out a fire and then end up just having to treat the cause. It involves constant adjustment, basically, until we find what works for that person. So my final thoughts. As you can see, doing this level of investigation in the complex chronic illness setting with many symptoms, many causes, and various concomitant illnesses, it can get pretty hairy. So remember the how superficial or how deep we're focusing and what is the goal? This is essential to use as a compass to keep us oriented so we don't get lost chasing our threads in circles, as it were. It's 2 cheesy puns. I'm on a roll. And I always make sure to zoom out occasionally to look at the big picture. Where have we been focusing our energy, and is it producing the outcomes we're wanting? Because sometimes it's worth spending time putting out fires, right? Before returning to the big picture. But other times you can really drown in those fires, so to speak. It can be kind of like trying to bail out a filling bathtub with a thimble. And so just take a breath, be kind to yourself, because it's a marathon, not a sprint. And so how you can connect with me, this is my website, onesongmedicine.com. There's also the little icon on the website that you can connect to my Facebook through there. And please join my newsletter, which I lovingly refer to as my song letter, because One Song Medicine. And you'll get a free handout on sleep support when you sign up for the newsletter. But please be aware that I am just dipping my toes into the world of, into the sharing with the wider world, basically. So there's a lot more to come. So if you go to my website and you're disappointed that it's not filled with tons of content yet, sign up and follow me because it's coming. You can sign up for a free FullScript account on my website, and this will enable you to view the categories of the different supplements that I like to use for like which symptom or whatever. And then I also have a myofascial care guide that's available for purchase on my website for $5. It has lots of information about myofascial health, ways to troubleshoot issues with pain and stiffness, and it includes supplement protocols that I get some really great results with. And I would love to thank the Support Fibromyalgia Network and Looms for Lupus for inviting me to speak today. Thank you so much for listening.